if you are a parent who has recently been told or informed that your child has ADHD, it can feel very overwhelming. It can feel very uncertain. There are a lot of unknowns. There's a lot of information on the internet and everywhere else. It's hard to know whether it is just like if your child is just like everybody else and is having some difficulties, or is this something that will last all his life or her life and cause problems throughout? Because both are true, and that's why it is so confusing. At a very basic level, yes, ADHD traits and in fact anxiety traits are population traits. We all have a little bit of them. But if your child has met a professional, that means at this point in time, those traits are getting in the way. That doesn't mean that these traits will cause problems all your life, but but at this point they are. So rather than worry too much about what will happen later, can we fix and can we mitigate the problem right now so that we are more prepared to deal with how long it will last and in what to what intensity will it last later on. On the other hand, data suggests that if you have symptoms consistent with ADHD, only 33% grow out of it and these symptoms are undetectable. A vast majority, 66%, will continue to have these symptoms even as an adult. But that doesn't mean that they will always face challenges. What I see in clinic is that when a family understands these traits, the limitations that these traits and symptoms bring, the strengths that these traits and symptoms bring, then there is less distress because then they understand why a child is succeeding because of this tendency and why a child is struggling because of this tendency. So they eventually are able to see that this is a package, right? This makes my kid think out of the box, be extremely creative, have a very wacky sense of humor, and likely identifying an absolutely new career or a new career path. But at the same time, their closet might be a mess. They might always be running last minute, always apologizing, and sometimes having a short fuse or being very irritable. So it's all part of the same package rather than seeing only the negatives of ADD or ADHD.